Welcome. Today we're diving into the world of heart health, specifically exploring a fascinating yet sometimes concerning condition called coronary artery anomalies. These are congenital heart defects, meaning they're present at birth and involve irregularities in the coronary arteries, the vital vessels that supply blood to the heart muscle itself. Understanding these anomalies is crucial for early detection, appropriate management, and ultimately improving the lives of those affected. So, what causes these coronary artery anomalies? Unfortunately, the exact cause is often unknown. These anomalies arise during the intricate process of heart development in the womb. Genetic factors are thought to play a role, and they may occur more frequently in individuals with certain genetic syndromes like Turner syndrome or Williams syndrome. However, in many cases, they appear sporadically, meaning they are not directly linked to an identifiable genetic or environmental cause. It's a complex area that researchers continue to investigate. To understand the impact of these anomalies, let's look at the pathophysiology. Normally, coronary arteries branch off from the aorta, the main artery leaving the heart, and deliver oxygen-rich blood to the heart muscle. In cases of anomalies, these arteries might originate from the wrong place, take an unusual course, or have abnormal connections. Some anomalies can lead to reduced blood flow to the heart, known as myocardial ischemia. This can manifest as chest pain, shortness of breath, or even a heart attack. In other cases, the anomalous artery may get compressed between the aorta and the pulmonary artery during exercise, also leading to ischemia. The severity and consequences depend on the specific type of anomaly and its impact on blood flow. Let's consider the epidemiology of coronary artery anomalies. They are relatively rare, occurring in approximately 1% of the general population. However, they are more common in individuals with other congenital heart defects. Some specific types of anomalies are more frequently associated with sudden cardiac death, particularly in young athletes. This highlights the importance of screening and early detection to prevent potentially life-threatening events. The prevalence may be underestimated as many individuals with these anomalies remain asymptomatic throughout their lives. Now, what are the signs and symptoms to look out for? It's important to note that many people with coronary artery anomalies experience no symptoms at all. These individuals may only discover the anomaly during routine screening or an investigation for an unrelated condition. However, when symptoms do occur, they can include chest pain or discomfort, especially during exercise. Shortness of breath, palpitations, dizziness, and fainting spells are other possible symptoms. In severe cases, particularly in young athletes, the first sign might be sudden cardiac arrest. It's crucial to consult a doctor if you experience any of these symptoms, especially during physical exertion. How are coronary artery anomalies diagnosed? A thorough medical history and physical examination are the first steps. Suspicion of an anomaly often arises from symptoms or an abnormal electrocardiogram (ECG). Non-invasive imaging techniques play a crucial role. Echocardiography can provide initial clues, but more detailed imaging is typically required. Cardiac computed tomography angiography (CTA) and magnetic resonance angiography (MR) are excellent tools for visualizing the coronary arteries and identifying any abnormalities. Coronary angiography, an invasive procedure where a catheter is inserted into the arteries, is sometimes needed for definitive diagnosis and to assess the severity of the anomaly. Coronary artery anomalies are classified based on their specific characteristics. Some common types include anomalous origin from the pulmonary artery at where a coronary artery arises from the pulmonary artery instead of the aorta. Another type is anomalous aortic origin of a coronary artery at AOK, where the artery originates from the aorta but in an incorrect location. Coronary artery fistulas are abnormal connections between a coronary artery and another blood vessel or a heart chamber. Myocardial bridging occurs when a segment of a coronary artery runs within the heart muscle instead of on its surface. Each type presents unique challenges and potential risks. Treatment and management strategies depend on the specific type of anomaly, the presence of symptoms, and the risk of complications. Asymptomatic individuals with low-risk anomalies may only require regular monitoring. However, symptomatic individuals or those with high-risk anomalies usually require intervention. Medications can help manage symptoms like chest pain. Surgical correction is often necessary to reroute the anomalous artery to its correct location or to create a new blood supply to the heart. Minimally invasive techniques, such as percutaneous coronary interventions (PCI) with stent placement, may be an option in certain cases. The goal of treatment is to restore normal blood flow to the heart and prevent future complications. Can coronary artery anomalies be prevented? Unfortunately, as these are congenital conditions, there's no known way to prevent them from occurring in the first place. However, early detection and appropriate management can significantly reduce the risk of complications. Genetic counseling may be recommended for families with a history of congenital heart defects. Promoting a healthy lifestyle, including regular exercise and a balanced diet, is beneficial for overall heart health and can help manage symptoms in individuals with coronary artery anomalies. What about the long-term outlook and the latest research? The prognosis for individuals with coronary artery anomalies varies depending on the specific anomaly and the effectiveness of treatment. Early diagnosis and timely intervention generally lead to better outcomes. Recent research is focused on improving diagnostic imaging techniques, refining surgical approaches, and developing new therapies to prevent sudden cardiac death. Studies are also exploring the genetic basis of these anomalies to better understand their causes and potentially develop targeted prevention strategies. Continuous advancements in cardiology are offering hope for improved outcomes and a better quality of life for individuals living with coronary artery anomalies.